here are some top suturing tips. First of all, if you are cutting, you should use the very tips of your scissors. Try to avoid opening them too much because you could risk cutting some tissue by accident. You should try and cut between where the blades meet in the middle because that's where the most tension is. How to use scissors in your left hand. You usually press down with your thumb and pull up with your ring finger. In your left hand, a trick is to flip the scissors so you're still pressing down with your thumb, but you are pushing up now with your ring fingers. You should also minimize the amount of damage you are causing to the skin using toothed forceps. Don't squeeze the skin with the teeth like this, rather use the teeth gently as an anchor to expose the wound edges. Another tip is you want to load your needle as you are pulling your needle through to maximize the efficiency. And then when you are placing your next suture in, you want to go slightly back on yourself to ensure there are no gaps in between your sutures. You can quickly become fixated on using the teeth of your forceps to expose the wound. However, it's important that you bring the skin back down like this to avoid a mistake that we term buttonholing, which is when your needle pokes through the skin like this. So it's important you bring the skin back down before fully pulling your needle through, because you can fix this quite quickly by pulling your needle back out. However, if you don't notice this, you might have to redo your sutures. Some surgeons don't like you to lock or ratch your needle holder. When ratching your needle holder, you get less tactile feedback. Specialties that do microsurgery, such as plastics, you can't ratch the microsurgical instruments, so it's good practice for micro.